So I paid 23 euros for this preventative colonoscopy in the private system, but you will get it for free. And by the time you're watching this, my wife Yoli will have had our second baby. And what's that costing us up front? Well, nothing. Spain's healthcare system isn't just affordable, it's also comprehensive and accessible if you set it up right. In this video, I'm going to help you understand how to get visa-ready private healthcare, how to handle pre-existing conditions, how to access the public system, medication, the realities of using the healthcare system here, and more. I live here. My family uses both public and private system, and I've helped over 1,000 people move here and set this up right. But there is one mistake that I want to point out that I see a lot of people making that can lead to denials. Let's walk and talk and discuss more. Okay. So how does healthcare actually work in Spain? Well, we have two systems and they operate in parallel. We have the public system and we have the private system. You know, most people in Spain have access to the public system and about 25% also pay into the private system, or their employer pays on their behalf as a benefit of working for that employer. The people who live in both worlds, I'm one of them, who has access to public and private, we effectively chop and change. We use both. But let's dig into each system a little bit more in detail and how it works. So the public system, how does that work? Well, effectively, it's funded through taxes, right? Through social security contributions that people pay because they are working in Spain. They're working for an employer or they're self-employed, and part of their payroll pays into the social security system, which funds healthcare. And if, for example, I'm working but my spouse isn't, then I'm the insured person under the kind of technical jargon, but my spouse is a beneficiary. So my spouse doesn't have to be working. The fact that we're married, in this case, my spouse gets access to the public system through me. And the same would go for our children as well. They are beneficiaries of it by the virtue of the fact that, you know, one person, a parent in this case, is working and paying into the system. Now, the public system is kind of functional. It's not the prettiest, you know, it can feel a little rough around the edges at times, but the level of care across the board is very good and Spaniards trust it a lot, specifically for long-term care, chronic conditions. It's true, like in many countries, it is under pressure as the population ages, but still it is a very, very solid system. But there's really two things that I think you need to know about the public system that are important. One is that there can be long wait times for non-urgent care. Wait lists are a classic issue in public health systems more and more, and this is really a pinch point, that if you've got something that is non-urgent, then potentially you might be on an 8-9 month or longer wait list, which is a real shame. Two, and this is more of a comfort issue, is that the public healthcare system works such that everything goes through your family doctor at your local health center. So if I want to go and see a dermatologist or I've got a skin thing, I have to go to my family doctor, and my family doctor will refer me to a dermatologist. And they will say, you've got a dermatology appointment at this place on this date. You can't really, you know, you can change it, but, you know, often there's a lot of demand for certain appointments, so you kind of take what you can get. But it does mean that everything really has to go through the family doctor. You can't go direct to the specialist, which is different from the private system. So just to roll back a bit, you know, for most visa routes for moving to Spain, you're going to need private health insurance. Not all of them, but for most of them, you're going to need private health insurance. And that private health insurance has to be able to operate in Spain and has to be the full Monty. Like it can't have copay, it can't have deductibles, can't have exclusions, can't have waiting periods, all this sort of stuff. So compared to the public system, the private system is more comfortable, less wait times, there's faster appointments, and also you can book directly with a specialist. Every private insurer will give you access to their Cuadro Médico, which is effectively their network. It'll be a booklet or these days a website. You can filter by the specialty, dermatology, cardiology, whatever it is. Find who's, you know, nearby and call up and book them. It really, really is that simple. And private healthcare in Spain really is very comprehensive. It covers almost everything, but there are a couple of caveats there. It doesn't generally cover pre-existing conditions, and two, it doesn't generally cover chronic conditions. So if something becomes chronic and ongoing, that may be excluded from your policy. So it can often make sense to, at some point, get access to the public system to give peace of mind. And that's where the public system really comes into play for those people in Spain who access both systems is that they know the public system's always there if they need it. So the $60 million question, what does private healthcare cost in Spain? What does private health insurance cost? It's going to depend on three factors, really. The insurer and your policy, right, that you go for. Your age. As you get older, it gets more expensive. And three, your location. Where you live in Spain will impact slightly the cost of your healthcare. For a couple, both age 60, who are living in Madrid, to get full comprehensive visa-ready healthcare, it would be about 330 euros per month. That is total. Now, I did mention earlier that I paid 23 euros for my colonoscopy. The reason for that is that I have a copay plan. I'm allowed to have a copay plan because I didn't need to get insurance for the purposes of a visa. I've already been living here for 10 years by the time I got private health insurance. So I decided to get copay. But if you're coming through a visa and immigration route, because you can't have copay plans for that, you got to have full cover. So it's going to be, well, pretty much the full cover one I just mentioned. And that's a general price. If you're younger, it's going to be less. If you're older, it's going to be a little bit more. Okay, so let's talk access. And let's start with the private system, because that's most likely the system that most viewers of this video are going to be accessing, at least at first. There are plenty of visa-ready policies created by Spanish health insurance companies ready to go off the shelf. This is an entire industry. So you're going to have your pick of multiple, effectively. You don't have to go out sort of seeking one out and building a policy. They're already there and they're visa ready. They're built in a way so that the consulate, for example, if you're going for the non-lucrative visa, will accept this health insurance. Now, you might already have a really good international health insurance policy, or you might be thinking of getting one that, operates internationally. Just a word of caution here. As I say, it has to be authorized to operate in Spain. And generally what that means is you're going to get a Spanish health insurance policy. It's going to be likely cheaper. It's going to be set up perfectly for the Spanish health system. All the documentation is going to be in Spanish already, which means you're not going to have to pay translation fees to get it translated, say, from English for your visa application. It's just going to be easier. And so this brings us to the most important aspect of applying for private health insurance in Spain. Do not go direct to the insurance companies. You go through someone called an agent or a broker, an insurance agent or a broker. Think of them as your priest and confessioner. You will share with them your health history, you will share with them any concerns, and they will help you create a strategy for your insurance application that will give you the best chance of success. And they won't share what you have told them with the insurance company. Obviously, doubly confirm that, but what you tell them is between you both, and then from there, you can figure out a strategy to get health insurance that is visa ready so that you can apply for the visa. But as I said, you don't want to contact the insurance companies directly. And now you might be thinking, James, you're suggesting I go through a middleman to contract my health insurance? Why? First of all, obviously, if you're applying for an immigration route, a visa, they are set up for this. They understand the consulate requirements. They're going to make it so much easier. They know what the consulate or the immigration department, whatever authority you're going through, they know what they're going to need. Also, you don't pay more by going through an agent or broker. You pay the exact same amount as if you went direct. So when you have questions about your health care, or you want to make a claim, whatever it is, your point of contact is your agent or broker. They are your English-speaking contact for all dealing with the health insurance company. So I speak Spanish, obviously, but if your Spanish is a little bit rusty or not quite there yet, that have continuity of service from somebody who speaks really good English, it's just a weight off your shoulders, right? I've mentioned agent or broker a few times. What is the difference? The only difference really is an agent is somebody who represents one health insurance company. A broker represents multiple. Sounds great. Where do I find a good agent or broker? Well, look, you go on any of the Move to Spain Facebook groups, people are recommending them all the time. So many people are using these people, these agents and brokers to set up their health insurance for Spain, that there's so many people out there who are able to recommend a good one that they have worked with. And I do recommend contacting a few, because private health insurance is a marketplace. You want to see what the different policies are, what the different options are, depending on your specific needs. But I will give a shameless plug for my guy, Janice. He's a broker. He works with some of the leading health insurance companies. He's super friendly, very resourceful, works all the time with people who are coming here through a visa, etc. So he's really experienced with that immigration side. My family, as I've said, we use him for our private health insurance, and he's just a fantastic guy. There's a link down below where you can get in touch with him. He's also the featured healthcare expert and insurance expert in my Move to Spain masterclass. Definitely recommend reaching out to him when you're checking out the options. And so then once you have chosen the health insurance company you're going to use and the policy, then the agent or broker you're working with will put together the documentation that you need for the consulate or for the immigration process that you're going through. And after that, you obviously apply for your visa, and assuming you're approved, you move to Spain, and your healthcare insurance policy will be set up from day one. The idea is it will need to be valid by the time you're living in Spain. So from day one, you will have access to that Cuadro Médico, as I say, that network website where you can choose your different professionals, dermatologists, cardiologists, whatever it is, and start using healthcare as and when you need it. Now, another question I get asked a lot is, James, what if I'm too old? Am I going to be too old to get healthcare coverage that's going to enable me to then get the visa? Guys, just briefly, if you're watching this video, it's because you're probably curious about what it would take to move to Spain. Well, I wanted to let you know that I've created a really quick 10-minute self-assessment that you can take, which is going to help you zoom out and get the real big picture of how close you might actually be to a move to Spain. What are the areas that you still need to take care of to make that move happen? And what some next steps are that you could take. It's a document you can download. It'll take 10 minutes. There's a few questions to go through. As I say, it's a self-assessment to figure out how close to a move to Spain you actually are. So if you want to grab that, you can go to spainrevealed.com/ready, or the links down below. Hope it's helpful. Let's get back to the video. Well, it's true that health insurance companies do have cutoffs for what age you can be when you start a policy. In some companies, it's 65. In some companies, it's 70. In some companies, it's 75. It just depends. So if you are, 70 plus or 75 plus, it's true that your pathway starts to get a little more narrow. That's when your broker or agent who's got experience with this is going to help you figure out what different policies are out there that are going to work for you given your situation. So yes, it can get difficult, but really your best bet is to talk to them and they can try and come up with a solution for you. In the context of pre-existing conditions, you're thinking, well, if it has to be this full healthcare package, what do I do if I've got a pre-existing condition? So that raises the question of how are pre-existing conditions assessed when you're applying for private healthcare in Spain, private health insurance. Effectively, when you apply for private health insurance, you're going to have to fill out a medical questionnaire. This is going to be a form, maybe a phone call, maybe a form and a short phone call, where effectively you tell the insurer your medical history and whether you have any pre-existing conditions. Now, one of two things is going to happen if you do have pre-existing conditions. Either one, that pre-existing condition is going to be excluded from your policy, or two, for more serious pre-existing conditions, you're going to get a full denial. And once you burn your bridge with a health insurance provider, you can't go back to them, right? You can go to other providers and see if they'll cover you, because the providers, the health insurance companies don't talk. They can't talk between each other. The other thing is cancer. So in 2023, a law was passed, a fantastic law was passed in Spain, which said that if you have been free of cancer for 5 years, then insurance companies cannot ask you about it and you do not have to reveal it. Effectively, they can't discriminate based on you having cancer in the past. Now, the time limit is 5 years. So if you're still in treatment or it's been more recent than that, then it is more complicated. But again, talk to the agent, talk to the broker, and figure out a strategy given that. But if it's older than 5 years, you're in the clear. So what happens if you do have a pre-existing condition? First, when it comes to applying for your visa, work with your agent or broker. They work with the consulates, the immigration authorities all the time in terms of helping people have health insurance for these processes. But two, you're thinking, well, I don't have health insurance, right, for this pre-existing condition. So how am I going to get health care? Well, you're going to have to pay out of pocket, at least at first. Now, often people say to me, hey, but what's that going to cost? I have no idea what that's going to cost in Spain. You know what? If you've got a condition that needs ongoing treatment or some sort of procedure, then you can simply email the private hospitals in Spain. Vitas and Quirón are two big ones, and ask them, what does it cost to get this kind of treatment? Also, my insurance agent, the guy I use, he does have a special policy that can cover pre-existing conditions for the first year. I've put his details down below. You can get in touch with him there. So he does have a bit of a workaround. But right, your first year, you're paying out of pocket, or you've got a special policy that covers that. What happens after that? You get on the public system. Yep, that's right, the public system. So there's a system in Spain, a concept in Spain called the Convenio especial. And effectively what this means is that after 12 months of legal residency in Spain, you can pay into the public system and thereby get access to it. If you're under 65, it's about 60 euros a month. If you're over 65, it's about 160 euros a month. And here is the kicker. Pre-existing conditions are accepted in the public system. Think of it almost like a private insurance, but you're actually paying to access public healthcare. And public healthcare doesn't care if you've got a pre-existing condition. You will get treatment for it. So once you get through that first year, then you can get in to the public system. Now, a couple of important things to know. Public health in Spain is devolved to the comunidades, to the different regions. So how you sign up depends on the region you're in. It's different in Madrid to Andalusia to Murcia, for example. And it can be a little bit bureaucratic, right? So I always think if you're looking to sign up on the public health system to pay into it, this is not working in Spain and getting access to the public health system as a worker. This is different, and we will talk about that. But if you're looking to pay into the Convenio Especial, then what you want to do is work with a local gestor, or it could be a relocation consultant, or you could just go to the local health center and maybe they're helpful. The other thing to know is that if you're paying into the public system through the Convenio Especial, you don't get your prescriptions included as if you would if you were working in Spain and accessing the public system that way. You have to pay for prescriptions. But we'll talk about prescriptions and medicine a little bit later. What is key here is you have now got that pre-existing condition covered. The other thing I will just say is if you're going to make this change, I always recommend speaking to an immigration lawyer as well, just to make sure you've got all your ducks in a row from the immigration perspective. So, the changeover doesn't come back to bite you when you go to renew, for example, your non-lucrative visa. Regardless of whether you have private insurance or whether you're paying into the public system or not, or however it is, you will always be provided with emergency care in Spain. You'll be taken to a hospital. Nobody's going to ask for your credit card up front. Nobody's going to deny you care because of whatever situation you're in regarding healthcare and insurance, etc. And now if you do have private healthcare and you wind up in a public hospital, once you are stabilized, what will most likely happen is you'll be transferred across to a private hospital. And then the private insurer will talk to the public system, and if any payments need to be made, that'll be sorted out between them. Okay, so what about the public health system? How do you access public health in Spain? Well, this is going to be for people who move here. If you move here and you're going to be working in Spain, so maybe you're coming on a digital nomad visa and you're going to be self-employed here. You're going to be paying into the social security system. By virtue of that, you get access to public health care. Or you're working for an employer, will largely pay into the social security system on your behalf. You'll still pay a little bit as an employee, but either way, if you're working, you're paying into it. So the actual steps you're going to have to go through to set that up, effectively that means registering your official address, where you've got a rental, so that you have an official document that says that you live there. Next, you want to go to the local health center. You want to take proof that you are on the padrón. As I mentioned, you want to take some form of ID. You're likely going to have to take proof that you are registered with the social security system that I mentioned, and then they're going to give you a health card. They're going to sign you up. They're going to give you a health card, assign you a family doctor, and from then on, you and your loved ones have access to public health. And importantly, that health card that I mentioned that you'll get when you get set up in the public system, that's really your key to accessing all the different, health services. Obviously, you got your healthcare number on it, which is unique to you. So it's kind of like the thing that you will use to access your healthcare. Also, when you get a prescription from your family doctor or a specialist, the prescription will be put on the health card. And so when you go into the pharmacy, you hand the pharmacist your health card and they scan it and they can see the prescription on the health card. So then they can fill your prescription. And actually, while we're talking medication, let's just take a moment and recap on this topic because it's an important one. So medication prices are regulated throughout Spain. Whether you have private insurance and you're paying out of pocket or it's subsidized through the public system, they are regulated. So it's quite possible that general medication prices are going to be less than what you're used to paying back home. But of course, it'll depend where you've come from. And so to be clear, if you're on private insurance, you're going to pay out of pocket for medication. In most cases, there might be certain policies that might subsidize it, but your prescriptions you'll be paying out of pocket. If you're paying into the public system, Convenio Especial, you'll be paying out of pocket. But if you are on the public system through working here, then in that case, you're going to get those heavily subsidized prices. And often people say to me, well, James, I know I'm going to be on the private system, so I want to know what my medication is going to cost once I move to Spain. What I recommend in that case is, say you're here on a scouting trip, go into a pharmacy, take in the pill box or the box that medication came in. It'll have the active ingredient written on it, and show it to the pharmacist and ask them what the price is. Or if you're just overseas, you're back home and you're researching this, then you can just find a pharmacy online, find a big pharmacy online and send them an email. And when you are moving here, I recommend coming with up to 3 months of medication. Generally, that's what you're allowed. You're allowed to bring up to 3 months of medication for personal use. You want to bring prescriptions and any medical information so that if you get asked at customs or something like that about the medication, you've got proof that it's for personal use and you do have a prescription for this. And you're not going to be able to fill your overseas prescriptions in Spain. You've got that first, say, 3 months of prescription medicine when you make the move. By that time you'll have had time to set up with your private insurance or, figure out a local doctor, and you just get a new prescription for it, a Spanish prescription, which then you take to the pharmacy and get filled. Super easy. So I mentioned the word pharmacy, and I do want to touch on how pharmacies work in Spain because it might be a little bit different from how they work back home where you are. So the first thing I would mention is there are a lot of pharmacies in Spain. You're going to see that green cross everywhere. And pharmacists are highly trained and are used to providing, some level of medical advice. So if you go in and explain certain symptoms, now obviously if you need to see a doctor, they're going to say you got to go and see a doctor. But they are very good at giving you some basic medical advice, maybe explaining certain painkillers you might need or whatever it might be, or some cream if you've got some skin thing going on. And something else about pharmacies that often surprises people, particularly people I find from the US, if you want to get painkillers or, paracetamol, ibuprofen, painkillers, you got to go to the pharmacy here. Those kind of painkiller drugs are sold only at the pharmacy. Now let's talk about practical access and experiences, the kind of the actual coalface of this. So I often get a question about, James, my Spanish is still rudimentary, and I'm wondering, am I going to be able to find English-speaking doctors? Well, look, if you're in Valencia, Madrid, Barcelona, yeah, you're going to be able to find doctors with, or specialists with probably a decent level of English. It's just the nature of being in a bigger city. If you're in a smaller place, it's quite possibly just going to be slimmer pickings. It's just the nature of size, right? And it might take a little bit of time, particularly say, when we're thinking in a private insurance, private healthcare context, to just kind of find your team. There might be a little bit of trial and error. You go to one doctor, you don't quite like them, and then you go to another one. And it's true that when you access the Cuadro Médico, that network website, often you can filter for language, and you can say, well, I want the ones who speak English. But just know that these filters, this information is often self-reported. So take it with a grain of salt, but at least that gives you a little bit of a starting point and an indication. And hopefully the doctor that said they speak English at least speaks some English, right? But I wanted to also give you some real stories of people using healthcare in Spain, people who have recently moved here. So I reached out to the alumni of my Move to Spain masterclass. One person, unfortunately, involved in a car accident, nothing too serious, but immediately they were taken to the public hospital and treated there, and treated really well, they said. And then once they were discharged and, it was all good, there was some follow-up things that they needed to get done, some scans and things like that. And they did those through the private system because they didn't want to wait and they wanted to go straight to a specialist. So that was a good example of someone using both systems in conjunction where, it made sense for them. And the other one was great. An alum shared a couple of stories, actually, one involving a colonoscopy, brother in arms, and another one involving a jellyfish sting. So let me take a seat and share those with you. So let's start with my fellow colonoscopy friend. Let's call him Michael, not his real name. So I've got some notes here that he shared with me, so I may check my phone to make sure I get the details right. They were here. Their first experience with the private health system was he needed a colonoscopy. I think this was an ongoing thing based on some treatment he'd had back home in the States. And so they decided to go through their local Bitas health center. They walked in, spoke a mixture of English and Spanish with the receptionist, kind of got it all figured out, and were offered a next day appointment with an English-speaking doctor. The blood work was arranged immediately, Michael said. There was no waiting, and the specialist offered him an appointment for the colonoscopy within 3 days. The only reason he said it wasn't sooner is because he didn't want to have an afternoon appointment. Anyone who has also gone for a colonoscopy will know why. Before moving to Spain, he said he had tried to schedule the same procedure in the US, and it took 5 months just to see the consulting doctor and another 7 or 8 months for the actual procedure. He later needed a follow-up CT scan, which was scheduled within a week. Approval came through the Sanitas app for the CT scan in English. The app was in English. Sanitas is a health insurance provider, obviously the one he had. And the whole process, he said, was quick and stress-free. He did also say the doctor showed more genuine concern and interest in his well-being than he'd ever experienced back home. Okay, and then comes his jellyfish story. Let's change benches for that one. Okay, our friend Michael, soon after moving here, got into open water swimming. And on one of his first swims in the Mediterranean, he was stung by a jellyfish. It was rather sore. So at first instance, he went to the pharmacist. The pharmacist gave him a topical gel, which he put on, and it kind of worked. But 2 weeks later, it wasn't really healing as quickly as he'd hoped. And so he decided to seek, medical advice from a doctor. So he WhatsApped, he says here, a photo of his sting to his doctor at 8 p.m. He's in WhatsApp contact with his doctor. That is not necessarily typical. He's very lucky. I haven't done that before, but the use of WhatsApp for important things is very typical in Spain. And the doctor replied at 11 p.m. that night on WhatsApp and gave him an appointment for the next day. And long story short, the next day he went to the doctor, was checked out, whatever treatment he was given, and now he's all good. And he said he paid $0 for all of this, apart from about €8 for the ointment from the pharmacist. He also said that his insurance broker, Janice, who's the guy I use and I recommended earlier, his broker, Janice, recommended Sanitas as the health insurance provider, given the region that Michael and his spouse were moving to. And he said, so far, the policy has worked everywhere they've needed it to, and it's been fantastic. He also went on to say that they have zero concerns going forward with Spanish healthcare and plan to continue paying for and using private healthcare even when they have access to the public system. So Michael, in this case, is going to sort of, use both systems in parallel, as many people do in Spain. So given everything we've talked about, let's do a little action plan for the steps you need to take to set up your healthcare when you move to Spain. So first of all, figure out what the requirements are for your immigration route. So if you're coming on a non-lucrative visa, you're going to need private health insurance paid up for the first year. If you're coming on the digital nomad visa, it's going to depend. Say if you're going to be working as a freelancer here, you will be paying into the local health system, and so you'll have that. But you still might want to get private healthcare as well to kind of cover you at the beginning and just to help with that first year, especially as you're setting up life here. 2, you want to contact agents and brokers and see, what the different options are, how they can help you get the healthcare that you need for your immigration route and for your life in Spain. Remember my guy Janice, who's fantastic. There's a link down below to get in touch with him. 3, you want to check medication prices before you move. If that's important for you, you can email pharmacies, you can visit pharmacies on a scouting trip. If you want to actually see what the cost of certain procedures are in a hospital, you can email, say, Quirón or Vitas, 2 of the big private hospital networks here, to understand what the costs are going to be. And then 4, when you actually move, it's important to bring medication with you. 3 months is generally allowed so that you have coverage before you can get a local prescription for things and start actually filling that prescription locally. And 5, plan for long-term care. So if it's going to be important to you to get on the public system after the first year, potentially because you're paying out of pocket for a pre-existing condition, then remember you have access to the Convenio Especial. So plan for that. And when the time comes and you've been a resident for 12 months, you can, use a local gestor or potentially a relocation agent to help you get all the paperwork and get that set up correctly. And guys, healthcare is just one part, obviously, of a move to Spain. So I made a video recently you can check out up here where I cover really all the other key areas you need to have under control to make for a successful move. So check that video out and we'll see you over there in a moment. All right, see you there.